Femoroacetabular impingement syndrome, or FAIS, results from imperfect fit between the proximal femur and the acetabulum, leading to severe hip pain and limited mobility. Corrective treatment includes hip arthroscopy, which in older patients has been associated with a higher risk of conversion to total hip arthroplasty. The severity of FAIS symptoms can increase in patients with concomitant borderline hip dysplasia, defined by a lateral central edge angle ranging between 18 degrees and 25 degrees. Optimal therapy for borderline hip dysplasia remains undetermined. Furthermore, in the patient population with borderline hip dysplasia, also undergoing hip arthroscopy for FAIS, the impact of age on clinical outcomes is not known. A recent study in the American Journal of Sports Medicine compared patient-reported outcomes at 2- and 5-year follow-up between older and younger patients with borderline dysplasia receiving hip arthroscopy. At 5 years after surgery, patients with borderline dysplasia who were over 40 years old achieved similar improvement in function, pain, and satisfaction compared to younger patients less than 40 years old. Older patients had worse sports function and achieved sports function satisfaction at a significantly lower rate, while older patients had a higher rate of total hip arthroplasty conversion with a mean conversion time of 4.58 years. They demonstrated similar overall reoperation rates as the younger patients. These findings suggest that age alone should not rule out hip arthroscopy in well-selected patients with borderline dysplasia, though the risk of later hip replacement should be discussed.